And now I'm going to embarrass Bashir in the most respectful way possible. It says right here on my speaking notes, Bashir prefers an introduction that goes along the lines of, I'd like to invite Bashir Jiwani to the stage. He does this every year. I usually don't read it right out because he's probably the most humble leader I've ever had the privilege of following. Please help me to welcome Bashir Jiwani.
So, I hope you're having a great morning. I'm having a terrific morning. And I want to start by just naming the fact that, David, Hillary, and Linda actually have a lot of people asking for their time. And so we really are very privileged to have them with us today. So just want to name that it's a gift that we have received this morning, and I look forward to ongoing partnership with them as we go forward on this journey. So thank you very much for that. My job is to try to do a couple of things. One is I want to sort of talk about how the work that we've been doing connects to ethics. So how is this about ethics, what we've been doing this morning? And then the second thing I want to do is try to set up the afternoon workshops so that you have a sense of what to expect when we go into those conversations. And so the first thing I want to say is that, there are multiple reasonable and legitimate ways of talking about this ethics stuff. So a number of years ago, when we were putting together an ethics course, I had the great privilege of visiting with leading bioethicists across North America. And I asked each of them, how do you define ethics? And each of them gave me a different answer. Right? There just are reasonable different ways of talking about this stuff. The challenge is that we live with, we work alongside, and we serve people who are different than we are. And as we encounter life, we do it together, and we need to have shared ways of understanding the world so we can go through what life gives us together. And so one of the things that Ethics Services tries to do is provide for Fraser Health a reasonable, legitimate way of thinking about ethics, not the only way, not necessarily even the best way, but a way of thinking about ethics that we found to be useful. And that way that we talk about it is this idea of living with integrity. So we say that ethics is the journey towards living with integrity. And you'll notice the alignment between integrity and the words cohesion and congruence, right? That we heard spoken about in the morning. So these concepts are aligned, the ideas are aligned, the language is slightly different. We just need to make sure that we have a common way of thinking about that. So that's the first thing I want to do. So I'm going to now talk about the idea of integrity because it's going to inform the way that we do the afternoon workshops and also the tools and the methods that we use at Fraser Health to try to work through difficult stories. And what I'm going to do is just pick one of the case studies that has been identified for the afternoon workshops. Some of you will use this, some will use a variation of this, some will have a completely different story altogether. But I'm going to use this to sort of to hang my talking about integrity on and to set things up. And so the story is really about Judy and Fran. So Judy's moving to a new team after having served as a senior social worker in an acute mental health setting for 12 years. She's now going to be joining a home health team, and things aren't going well. She's become very guarded because of the interactions she's had with her team, her colleagues, and in the way that she's approaching her work. The team itself has an identity, and it has a way of being. They often go out together, and when they started to go out together at the beginning of Judy's joining, they invited Judy to join, but Judy never did take them up on their offer. And the view has emerged amongst the team that Judy is not a team player. She doesn't socialize. She doesn't always consult with everybody that everybody thinks should happen before she makes patient care decisions. Her colleagues have decided that she's not effective in team meetings, that she's hesitant, and really doesn't want to be a part of the team. One of these social occasions, at some of these social occasions rather, the team members talk about Judy. They talk about the clothes she wears. They talk about her performance at the office, and this conversation happens. And at one of these meetings, it's not a meeting, it's actually a social gathering, Carol, one of the clinical coordinators, was present, and she heard this, and she wanted to hear more. She was, tell me what's going on. And the team members present said to Carol that the team does not like Judy. She's not effective and doesn't want to be part of the team. So Carol spoke with Fran, the program director, indicating Judy's not working out. She's a problem, and this is not a good fit. So Fran meets with the staff monthly, and in her monthly meeting with Judy, she asked Judy, how are things going? And Judy started to tear up at this question. She says that she's thinking of leaving the team. She feels confident in her mental health experience, but not so confident in her new role. She hadn't realized how hard it was going to be to work with this team. She mentions that the team members keep comparing her out loud to a former social worker they had on the team whom they didn't like very much. Judy tells Fran that the team seems uncomfortable with mental health issues, and that she was shocked when some team members made derogatory comments about some patients. They were dirty or smelly, or that the team couldn't stand some of them. Judy also said that there isn't really openness to critical discussion. So when she said, this patient who has been diagnosed with a bipolar disorder may actually not have a bipolar disorder, the team members got very upset. How can you question the judgment of the psychiatrist? Not acceptable. So she got in trouble for that. And when she got some admonishment about that, she got angry. And in the result, or after that, she felt really embarrassed about the way she acted with her colleagues. So there was all this stuff going on that she was trying to work through. So Fran now needs to figure out what to do. She's sympathetic to Judy, but you know what? The fact of the matter was, hiring a social worker for this team was not easy. It took a lot of time and a lot of effort and energy. And Fran really wants to make this work. And so she's got to figure out now how to deal with this. Right? So just a story that we'll work through, a typical story in a sense, the kind of thing that we face every day. So how is this about living with integrity? Well, what I want to say is that, sometimes we encounter people that say that, Bashir, this is a clinical practice issue, or it's a communication issue, or it's a budget issue. And the first thing that we want to say is that, it's not the first thing actually, that ethics is, if you think like that there are these buckets of issues, then ethics has got its own bucket. There's a bucket of things that are ethics and not other things. And our approach is to say, actually, that's not true. That everything that we deal with, whether it's about patient care, whether it's about dynamics with our teams, whatever it is, everything has to do with ethics. Why? Because everything is about our values. And I'll say more about that in just a moment. Okay, a couple of words about integrity, and then I'll unpack this. So we're saying that ethics is a journey towards living with integrity. What's integrity? How would you define integrity? Somebody? Practicing your values, right? It's about understanding what should matter in life and then having that show up in the world, demonstrating that to the world, right? Ethics is about practicing your values, walking your talk, right? Now, what's going on in the story, notice, and happens all the time, is that we're trying to figure out, well, what is the talk that should guide us? Fran is trying to figure out what should matter so I can actually live that stuff in my life every day. When I'm trying to resolve this problem, what should matter, and then how do I actually have that show up in my life? So we encounter this stuff every day. So that's the first thing. The second thing that I want to suggest is that integrity is actually tied to our peace of mind. So I think that this spectrum of pictures that you see, all of us are somewhere on this spectrum. The extent to which we understand our talk and we're able to walk that talk is the extent to which we're on the right side of the spectrum. When that person shows up into a room, everybody knows who that person is, they know what she's going to stand for, and they know how she's going to react in situations. And when we're on that side of the spectrum, we're usually feeling pretty good. We're feeling calm, peaceful, maybe even happy, because what matters in life is showing up. When it's the case that we are not able to walk our talk, either because we don't know what our talk is, or we lack the courage to walk that talk, or because we're prevented by external forces from walking our talk, from having what we think should matter show up in life, is the extent that we're on the left side of the spectrum. When we're on the left side of the spectrum, we actually don't even know who we are there, right? You can't tell who that's a picture of. And when we're on this disintegrating side of the spectrum, it shows up in our hearts and our bodies, in feelings of guilt, anger, sadness, frustration, powerlessness. And these are things that in the literature we refer to as moral distress. So let me illustrate this very quickly with a personal story. The most important thing in my life is my relationship with my son. And so I love to hang out with him. It gives me immense pleasure. So imagine now, it's a Sunday morning. Some of you have heard this story, bear with me. It's a Sunday morning, and Rafik and I are out for a bike ride. And it's a beautiful day, and we're talking, and we're riding, and we're having a great time. How am I going to be feeling? Blissful is what I would say. Fantastic, certainly peaceful and calm. Why? Because what matters is showing up in spades in my life. Now imagine, out of the blue, for no reason that I can understand, a truck shows up and is driving and is aiming directly at my son. And it looks like it's going to hit my son. How am I going to be feeling? Petrified, freaked out, scared out of my mind. Why? Because what matters to me, all of a sudden I think is in jeopardy, is in peril. I'm scared I'm going to lose it, or that I've already lost it. So what I'm saying is that anytime you can actually, so this is a side point, anytime, even right this moment, you can check in to see what's going on in your heart and your body, and what you're feeling is actually an indicator, a barometer of the extent to which you're able to live with integrity. The extent to which what matters to you is showing up in your life. That's the second thing that I want to point to. The third thing I want to point to is, in the story of Judy and Fran, whose integrity is on the line? What would you say? Everybody's integrity is on the line. Everybody is trying to get through that story in a way that gives them what matters to them. But the challenge of life is that one of the challenges of life is that we feel we're very well versed with what's going on in our hearts and our bodies. We feel our pain and our pleasure. But we have to exercise our minds and our hearts to try to figure out, well, what might that person be feeling? And no matter how hard I try, I can't actually know. I can only try a guess. And what happens as a result of that is that when Fran is in the story, she knows how she's feeling her pain points. But she's it's hard for her to know what Judy is experiencing. Fran needs to do work to understand what Judy is experiencing. So it becomes about Fran, or it becomes about Judy, if we're looking. The point is that we're very well versed with the compromise to integrity we might feel in a situation, but it's not easy for us to realize that other people's integrity might be compromised as well. So as we think about this journey towards living with integrity, we have to recognize that it's actually everybody's integrity that's on the line. So that's how we're thinking about this idea of living with integrity, that we are all on this journey towards it, and ethics is about doing this. Actually, let me make the second point quickly. We've heard about the importance of what's important when it comes to team dynamics. And in a way, it's what we're doing is practicing stuff that we think we know or we should be practicing. Like, it's kind of making articulate and obvious what should be happening already or is happening in some respects. So how is this relevant? And I want to give you one more way of thinking about ethics quickly before I move on to the next part of this. So the story, again, I'm going to tell, some of you have heard, my wife and I were at a flamenco concert once. And there was this man and this woman. And they were doing this dance. And it was passionate, and it was beautiful, it was expressive, it was creative. And I turned to my wife and said, honey, that's ethics. And of course she said, honey, shut up. This isn't the time. But then afterwards she said, well, what do you mean by that? And I said, well, notice that everything that they were doing on that stage, yeah, it was beautiful, passionate, expressive, creative, but it was deliberate. It was intentional. They were not being moved by any force other than what they had thought was important in their dance. We're acting as teams every day. if we're not owning the way that we're behaving as teams, we're not free. We're simply being pushed around by whatever forces happen to be strongest in our teams. So ethics is the journey towards intentionality, towards freedom, to choosing the way that we're going to behave, and not simply being moved around by whatever forces happen to be strongest in our lives. And the gifts that we got this morning were skills and exercises that will help us to understand and think about what we want to be moved by so we can be free and accept intentionally the constraints we will be acting according to as teams. Okay, so that's so far. Now what I want to say is, if integrity is about walking your talk, well, how do you figure out your talk? Where does it come from? And what I want to suggest is that to live with integrity requires skills related to two types of things: critical thinking on the one hand, and pluralism on the other, okay? And I'm going to just unpack those ideas very quickly. So when I talk about critical thinking, what I'm saying is that our talk is actually made up of at least three different types of talk. And we need to be skilled at making sense of all three different types of talk. Specifically, I'm going to just first focus on, well, here, I think they're here. The three different types of talk are: one, values, or what's important; two, facts, or what the world actually looks like; and then three, what's going on in our hearts. So let me talk about each one of these quickly in turn. What does this guy think is important?
Look what I drew for you, Dad.
Oh, hey, that's awesome. Cat.
It's a dinosaur, Dad.
Oh, wow, awesome dinosaur, buddy. Touchdown.
So, for better or worse, we are always showing the world what matters to us. We're always showing the world what matters to us. This dad is demonstrating that I love my son, I also love football. Right? Those are things that are important to me, to spend time in those spaces. And they suggest equally important. Okay, so part of ethics is, part of our talk is what matters to us. And ethics is about the skill to understand what we are demonstrating, and then what we have good reason to think we as a team should be demonstrating. Your teams are already demonstrating values. This work is about saying, what are the values that should be guiding how our teams work? When Fran and Judy talk to each other, they have a values conversation going on. Fran is really saying, Judy is saying, it's really important that we don't judge our patients. It's really important that we have good clinical practice, that we have accurate diagnoses of our patients. It's really important that teams or team members demonstrate respect to each other. Fran is saying it's really important that we're efficient in the way that we make business decisions, that it's important for teams to be supported to get along. There's a bunch of values that are informing that conversation. So that's part of what's going on in their conversation. There's something else. What does this guy think is true about the world?
Again, this is the USS Montana requesting that you immediately divert your course 15 degrees to the north to avoid a collision. Over.
Please divert your course 15 degrees to the south to avoid collision.
This is Captain Hancock. You will divert your course. Over.
Negative, Captain. I'm not moving anything. Change your course. Over.
So, this is the USS Montana, the second largest vessel in the North Atlantic Fleet. You will change course 15 degrees north, or I will be forced to take measures to ensure the safety of this ship. Over.
This is a lighthouse, mate. It's your call.
So notice that it doesn't matter how passionate we are, how hard we work, or how much power we have. If we don't have the facts right, we can't make good choices, right? So ethics depends on understanding. So one area of talk is what should matter. Another is, what are the facts? What does the world look like? Ethics requires the skill of being able to figure out what's really going on in the story. And again, as Fran and Judy talk, they're having a conversation about what the facts in the story actually are. How does this team work? What is required for people to be happy on this team? How do we work together about making sure that we have the right diagnoses for our patients? Whatever those facts actually are. Those are implied in the conversation. And I'm going to indulge and show this clip that I just found heartwarming. But what I want to say, so ethics is about living with our integrity. Integrity is about walking our talk. And our talk is made up of our understanding of what's important in life and what the facts on the ground are. But the thing is that we're not just thinking and behaving creatures. So indulge me for a minute. What's going on for this little boy? The one that's going to be on the right. Oh, both of them.
Hold it out.
Wait, guys, wait. Tell us what's happening here.
We're gonna open this present.
From who?
You.
Ready? Here we go. Go ahead.
Chocolate fountain. And then this. Some cool clothes. Chocolate. The chocolate for the chocolate fountain.
Oh, yeah.
Right here.
You guys finally get your own chocolate fountain. What do you have to say about that? Don't open it yet. Don't open it yet.
Don't open it.
Yo, put it together when you get home.
Okay.
You okay, Peter? No.
This is my dream come true.
We encounter life, and it has an impact on us. We feel things. David was pointing to this earlier, that we are feeling beings. And yes, there are paradigms of practice where that emotional stuff is pushed aside. But we cannot deny the reality that we are feeling beings. And if it's the case that we're going to live with integrity, we need to be able to be emotionally competent, emotionally congruent. Why? For several reasons. One, I've said that when it's the case that what matters to us shows up in our life, we feel good. When it doesn't, we have painful feelings. Well, if I'm attuned to how you're feeling or I'm feeling, I'm able to understand something about your values. I know that what's going on in the world is either giving you what you want or isn't, which means I can start to understand, well, what might that be? The second thing is that if we're not able to process our own emotions effectively, then, as David said, hurt people hurt people. If it's the case that the way that Fran or Judy or Carol or one of the staff reacts badly to the other person, then what's going to happen is they're not going to be able to do the work of figuring out what should matter and what the facts are. They're going to be caught up in this emotional space, and they're going to create additional barriers to actually figuring out what our talk should be so we can actually walk it. So the emotional dimension of it is crucial. So again, in the conversation between Fran and Judy, whether they acknowledge it or not, they are both feeling lots and lots of stuff. And they need to be able to process it for themselves and each other to productively decide how to go through that. So the point here is that in any conversation between two people, there's actually 3 conversations going on. And to live with integrity requires the skills to manage all 3 levels of conversation. And when you see the workshops, when you go into those concurrent sessions and you actually use the tool, you'll see the facilitators systematically think about what the values should be, what the facts are, and depending on how it goes, what's going on emotionally. Now, the other piece that I want to talk about is this business of pluralism. Because I've said that living with integrity is walking our talk. Our talk requires the ability to think critically about some areas, but I also think it requires a certain type of reaction to difference. How do you react to difference? We live, serve, work alongside people who are different than us. How do you feel about that? Here's Mum's response to that.
Scott Harris.
Oh, look, there he is. Look, there he is. Scott, hello.
That little turd's in the picture.
So glad he's wearing pants.
No, look, it's fine. Look at this, look. There, all gone.
Look at that. Nice save.
So some of us say, you know, difference is a pain in the ass. And really, I just wish I could get rid of it. Because if I could get rid of it, life would be so much easier. And I think that's true. Life would be a lot easier if we were all the same. But I actually think the difference is required for integrity. If integrity is about walking my talk, how do I figure out what my talk is? The way I figure out what my talk is actually by talking to, articulating my perspective and hearing competing perspectives, right? Should staff members socialize together? I don't know the answer to that. I have an initial reaction to that, but I haven't thought that through very carefully. The team members have very different reactions to that. Judy thinks the team members should not be socializing together. The other team members seem to think you should be. Do they really know what the answer is? They're going to have to talk to each other to figure that out. It's by engaging difference that we actually have a deeper understanding of our own values, our own understanding of what the facts on the ground are. I have to expose myself to different people so that I can learn better who I am. Does that make sense? I'm tempted to tell you a story. Okay, I'll tell you a quick story. Again, some of you have heard this. It's my figuring out my end-of-life care plan. I'll tell you the story. Okay, so I was doing work in end-of-life care, and I realized that I didn't have a sense of my own end-of-life care plan. What did I want? So I went for a long walk, and I figured out that what I love in life is working with people to solve hard problems. And so I came back, and I told my wife, I said, honey, you know what? I really love my work. And so if it's the case that I get sick or injured or something like that, and I have big ideas about what happens after I die, it's all good. You go ahead and just, you know, don't continue the treatment or whatever. Just let me pass on. And of course, she looked at me and she said, honey, that's selfish. I said, well, what do you mean by that? She said, yeah, you might not be able to do have your highfalutin thoughts and do all this fancy stuff that you seem to think you do. But we might still be able to love you. We might still be able to look after you and be in a relationship with you. I was like, oh my God, she's right. Because really the most important thing in my life is my family's well-being and their happiness. And if it means sticking around for a while so that we can do this, then I'm fine with that. As I say, everything is good after I go, so why not stick around? So I realized, so I said to her, fine, and you just decide, why the hell did I waste my time? But the point is, I wouldn't have known that if I didn't share with her what I was thinking. I needed to expose my own perspective to her so that I understood who I am and what I want in life. So here are another couple of spectrums that we're on, between fear and hope and being alone and in community. I'm saying to live with integrity, you need to be on the community side of the spectrum, not because life's easier, but because that's how you figure out who you are. And you figure out how we should live our lives so that we're actually living up to what's important to us. But in order, as we've heard earlier, to be on the right side of the spectrum, we need to be able to make ourselves vulnerable. We need to have the hope that when we share what's in our hearts and our minds, that the people who we're talking to give a damn about us. If Judy starts talking and she's shunned or she's pushed aside or she's called names, well, she's not going to be willing to partner. She's going to go into isolation phase. She's going to protect herself because no one else is going to. So she needs to hope that, she needs to know that she can trust her colleagues to give a darn about her perspective and to be willing to go on the journey with her to figuring things out. So she needs that trust. And in our view, and this is the language again, the only way that we can have trust is if we treat each other with respect. But as David said, this word respect has become very airy-fairy. It's unclear what the heck it means. And we need to have a very clear definition of what it means to treat each other with respect. And so that's what you have on your cards on the flip side of them, what it means to treat each other with respect. And what we're saying is that respect requires 3 levels of behavior. It starts with treating each other kindly, gently, and well. No one disagrees with that. We have to be kind to each other. Well, if that's true, then why don't we see so much kindness in the world? What's going on? And I think part of it is because we don't realize that we treat people who have, that kindness in my view is actually all about power. Think about how you treat people who have less power than you compared to the way you treat your boss, right? I suspect that all of us, myself included, treat our bosses with much more gentleness and care than we do people who we can push around and tell them what we want them to do, right? And so treating people with kindness and care is about treating them as if they have as much power in the relationship with you, even when they don't. The second thing that respect requires is listening to understand, as we've heard. And this is about suspending judgment for a moment. This is about the value of humility. So this is a story that I'll share. What is it, for those of you that don't know the answer to this question, what does it feel like to be wrong? And my favorite story, of course, is about my wife, because I asked her, honey, as I was doing this, what does it feel like to be wrong? She scratched her head. I have no idea. To me. Anyway, what does it feel like to be wrong? Sorry. What does it feel like? The common answer I get is that it feels embarrassing, that it's humiliating, right? Now that's a sad statement, I think, but we won't probe that here. But the point I want to make is that that's not what it feels like to be wrong. That's what it feels like when you find out you're wrong. Until you find out you're wrong, it feels exactly the same to be wrong as it does to be right. So the point of that is that our conviction that we have things right, that we know what the right answer is actually a poor indication of whether we actually are right or not. And the reality is that we go through life with a very limited view of the world, and a view that nobody else has, but there are millions of people around us who have a view of the world that we don't know. And so treating people with respect at this level is about putting our own stuff away, recognizing that our own views are limited, and that we need to understand the perspective of others, first without judging, to really understand what the world looks like, what do they think the facts are, what should matter, and how are they feeling. And then integrity requires showing up. I should say, showing up, or respect requires showing up. In other words, it requires telling our partners, yes, this is what I think. This is what I believe is important, and this is what I think is true about the world. And now, how do we actually work together to build a broader understanding of what should matter, of what the facts are, and then build a solution together based on that perspective? So that's the idea of respect that, again, you see on the cards on your table, very resonant with the way that, we've heard about it so far. Okay, so what are we going to be doing in the concurrent sessions? What we're going to be doing is using a case study to practice a decision process that will hopefully allow us to arrive at an ethically justified response. Now, the time that we have won't allow us to get through the whole process, but we're going to practice elements of it. And the idea is that this tool, this method of thinking, is something that guides all of the ethics support that's provided at Fraser Health. So we're going to give it a chance to practice this. But the other thing is, again, integrity equals critical thinking plus pluralism. So yes, it's about doing this critical thinking, but it's about doing it in your team. So what we want to be doing is asking ourselves, okay, we've talked about safety and inclusion and trust. As we have this difficult conversation about this case, are we living up to those values? If we think about those 3 or 15 values that each table identified, are we manifesting those values in the way we talk about this case? Are we treating each other with respect in the way that we're talking about this case? So it's about the critical thinking, but we're doing it in a group. So how about the way the group is working? What is the relational ethic, if you will, of the way that group is working? That's what we're going to be practicing in the afternoon. And what I want to simply name is that I want to call attention again to the fact that our conversations today are being facilitated by our lovely table hosts and facilitators. They have all done some work in trying to learn this method and to facilitate conversations using this method. Some of them have been doing it for 10, 12 years. Some of them have been doing it for only 1 year. But it takes a lot of courage for them to come and to contribute this. And so I want to just thank them, not just for the work that they're going to be doing, but the work they've already done in leading your conversations. And B, I want to ask for you to treat them kindly along the way, because it is really hard work to manage difficult conversations, and do it in a very systematic and organized kind of way. So that's what we're going to be doing. Some of you have chosen your own cases. That's terrific. If you've had a chance to revisit the case that you've chosen and want to tweak it, that's for you to work out with your table host. That's just fine. The one wrinkle I want to make you aware of is that we were going to have 2 different groups in this room. We will still have 2 different groups, but we're going to treat it as one big session. And so you'll still be guided by your table host / facilitator to go to where you're going to do the work, but we'll be just convening as one large group. So that is what I wanted to share with you. Thank you very much.